Welcome back to Body Beautiful. We are talking right now with Dr. Joseph Mele about rhinoplasties. And first, let me remind you that we'll be taking your calls with any questions you have for Dr. Mele about plastic surgery and noses specifically, but I think he's open to talking about other things. The phone number is 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we give you today, you want to always get a second opinion. Dr. Mele, we were talking about the combination. Do you oftentimes find people that come in for corrective, I call it corrective surgery. I mean, sometimes noses just get battered. They're,
Sure,
they stick out.
And that's part of the exam. When I'm evaluating someone for rhinoplasty, whether it be cosmetic or functional, I always want to know if the nose is working or not. And if it's not working, it's usually a good time to get in there and figure out why.
Yeah, breathing is a good thing.
Breathing is really nice. I tell
Okay.
you, I can make a beautiful nose, but if I make it breathe better, patients are happier about that.
Oh yeah, oxygen in the brain and all
Yes,
kinds of good things. All right, we promised we'd start taking some of your calls. Let's go ahead and let's start with Rose from Santa Rosa. Good morning, Rose.
Hello.
Hi, do you have a question for Dr. Mele?
Yes, I wanted to find out when your nostril is flared out, and it makes your nose go flatten. How they can fix that?
Flaring nostrils.
If it's flaring with motion or just it's wide to start with?
Rose?
Too hard a question.
Okay, maybe she can't hear.
Because there's different things to do for the nose. If the nose is wide, there are procedures that can reduce the width of the nose, that is, bring the nostrils in. If it's that it's moving, then that's a different problem, and sometimes we need to not just change it in a static position, but sort of restrict the motion. So there are two different problems, both of which can be treated. But again, it's important to make sure that it's not going to interfere with your breathing, because breathing is the most important part of the function of the nose.
Is there a certain amount of nasal flare that is natural? I mean,
surely. Yeah, I mean, some people, when they smile, their nose becomes very, very broad, and it will be bothersome to them if it's getting too wide.
And you can actually reduce the flare by and not restrict the air that comes in?
Yes.
All right,
yes.
well, that's, again, we're big on having a fresh air.
The funny part about plastic surgery is if you have a problem, there's probably an operation to try and fix it, because someone's had that problem before.
Isn't that true? All right, well, let's go ahead and try another phone call here from Berkeley. Good morning. Do you have a question for Dr. Mele? Is this
me?
Yes.
Oh, okay. Yes, my question was, what can they do about the bone loss in the for your teeth?
Okay.
Bone loss for teeth?
Like you lose. For instance, I have no back teeth in the lower part, and then my face is shrinking in, and I wanted to know what can they do to help that, where I can have normal teeth, because I need to have.
I would recommend not seeing a plastic surgeon for that. I would send you to someone who deals with the mouth, and you want to see an oral surgeon. Because if the bone is atrophying, if you're losing bone, it may require bone grafting. And there are a lot of really interesting new techniques that can help with that, to help restore it. Because you're right, as the bone is lost, the mouth kind of shrinks, and the lips fall in, and the lower part of the face becomes smaller. But if I'm working in that area, I'm working with someone who's used to working in the mouth.
Yeah, Dr. Mele, that is actually something I've heard a little bit about. People that do suffer bone loss with the teeth, their facial structure starts changing.
Yes, because as it atrophies, everything kind of shrinks, and the bone is the foundation. So if the foundation's changing, the whole house is changing.
Right, but to start with the foundation, you want to go to somebody who lays bricks or who
she's
deals
asking
with
more
the
about
foundation
teeth,
first. Yeah.
and in terms of teeth, plastic surgeons don't usually deal with teeth very much.
Right.
Other than when they're in the way in a fracture, we usually take them out, so we're not very good with teeth.
So if you are experiencing that, you would start with building the teeth back up, and then hopefully the face will readjust
building
accordingly?
the bone. So first you want to get that foundation set, and if it's that the teeth are starting to be lost, sometimes you can keep the teeth there by putting a good graft in. Also, you want to make sure the gingiva is okay, the gums are good, and you need those to be functioning in order for the teeth to be maintained.
Okay. Question for you about hospitalization. Is this something, let's say if you're having a standard, if there is such a thing, as a rhinoplasty, does this require an overnight stay, or is it an in-office procedure?
Normally I'll do this in an outpatient setting, so it's an ambulatory surgery center. The operating rooms are the same as in the hospital. We have the same equipment and staff and such, but you don't need to stay overnight for this usually.
And in terms of the anesthesia, do you have a choice, or are you totally knocked out? Or
I usually do it with people totally knocked out. You know, other than the stuff on the tip of the nose, that can be done under local with some sedation. I probably could do regular rhinoplasty under local with sedation. It's just not as comfortable. And I worry a little bit more when the patient's awake because it's a sensitive area.
Yeah.
And if I get to a point where I hurt somebody, that's not really my goal in life. My goal is that they're happy, they enjoy the procedure, they've got their recovery to do afterwards. I don't want them to be traumatized during the surgery itself.
Of course. We've got more phone calls. We've got to take a really quick break. For more information about Dr. Mele, call him at 925-943-6353 or check him out on the web at drmele.com. When we come back, we will be continuing our chat about rhinoplasties with Dr. Joseph Mele, and we'll be taking your phone calls.